There are many signs and symptoms of bronchitis. Some of them include a cough, a whole body fatigue or being tired, a runny nose or nose drip, chest tightness, a headache, shortness of breath, having trouble sleeping, and a very sore throat. These symptoms are relevant for both acute and chronic bronchitis, although acute bronchitis typically would have a nagging cough for several weeks. The chronic bronchitis cough lasts well over 2 months, and the signs and symptoms will worsen over time. It could occur for 2 consecutive years in the worst case scenario. It is also possible for acute bronchitis and chronic bronchitis to coexist. There are similarities and differences in the signs and symptoms of these two types of bronchitis, but it is important to know that acute bronchitis is much shorter, as it only lasts for 2 to 3 weeks and heals faster, while chronic bronchitis can last longer and has long-term effects. One big factor that plays into chronic bronchitis is smoking. Any type of smoking, whether it is marijuana or cigarette smoke, can affect your lungs and impact them badly. People who smoke regularly have a greater risk of getting chronic bronchitis than people who don't. Over 90% of bronchitis cases involve a viral infection. The virus can be spread through direct droplet transmission when people cough, or directly. Some examples of the most common causes are influenza, parainfluenza, RSV, and corona. Smoking is the biggest factor when it comes to bronchitis, along with air pollution or bad air quality. Genetics can also play a big part into someone getting bronchitis. The pathogenesis of bronchitis is fairly simple. The mononuclear cells infiltrate the respiratory system of the victim. Once these cells have entered the person, the cells create an inflammation within the person's bronchial tubes. The response is to create mucus in the tubes to help soothe the tubes, but this only clogs the tubes and makes it difficult for air to come in and out, which results in heavy coughing, mucus, and other bad things that come up from the tubes. Some of the most common viral infections that cause bronchitis are influenza, parainfluenza, RSV, and corona. The pictures on the slide are diagrams of some of the different viruses that can cause bronchitis. One thing that is pretty noticeable is that all three of the viruses pictured are round and in a spherical shape. These viral infections typically can get into someone's body through direct or indirect contact. Common ways diseases are passed are through coughing and sneezing, or by touching or shaking hands with another person. Bronchitis is not a disease that can be prevented easily. By far the most important thing to do is to quit or never start smoking. Chronic bronchitis has been linked to the flu, even though this seems unrelated. So getting your annual flu vaccine is the most important thing to do to stop bronchitis besides smoking. Once you have bronchitis, however, there are only so many things you can do to treat it. Doctors may give you antibiotics, but this is just to prevent secondary infections from entering your body and worsening your symptoms. Loosening the mucus in your body is important for helping soothe the pain of bronchitis. Humidifiers are a good investment because they loosen up this mucus. Hot tea and lots of water also break up the mucus in your sinuses and will help rehydrate your body. Cough medicine can be used, but should only be used if one has a persistent, painful cough that inhibits them from sleeping at night, which is vital for getting better. Bronchitis is not a disease that can be prevented easily. By far the most important thing to do is to quit or never start smoking.
Bronchitis, however,
Chronic bronchitis has been linked to the flu, even though this seems unrelated, so getting your annual flu vaccine is the most important thing to do to stop bronchitis besides smoking. Once you have bronchitis, however, there are only so many things you can do to treat it. Doctors may give you antibiotics, but this is just to prevent secondary infections from entering your body and worsening your symptoms. Loosening the mucus in your body is important for helping soothe the pain of bronchitis. Humidifiers are a good investment because they loosen up its mucus. Hot tea and lots of water also break up the mucus in your sinuses and will help rehydrate your body. Cough medicine can be used, but should only be used if one has a persistent, painful cough that inhibits them from sleeping at night, which is vital for getting better.